Hello everyone, my name is Dr. Sienna Miller. I'm a naturopathic physician based in Washington State in the greater Seattle area. Welcome to my YouTube channel. This is my first video back in over 2 years, so I'm pretty excited about it. I thought I would get things started with one of my favorite topics, which is GI, digestive concerns. GI and dermatology are my top two specialties, and I plan to start making a lot more videos, mostly focused on those topics. I probably will cover some other topics if you want to hear or follow along to get latest videos on naturopathic medicine type topics. Go ahead and make sure to follow my channel for more. I'm kicking things off with talking about one of the most common conditions, complaints I hear come into my office, which is irritable bowel syndrome or IBS. And I'm going to talk about why I don't actually agree with that diagnosis. Why I don't like that diagnosis is because it's a diagnosis of exclusion, right? It's like a lot of other things have been ruled out and we can't really figure out what's wrong with you, so we're going to give you the diagnosis of IBS. That's not saying, like, me not, really loving that diagnosis is not saying that the symptoms that people are experiencing are not valid and actually going on, because they 100% are. Why I don't like that diagnosis is because it kind of stops the investigation. And what I found in my practice is that there is a lot more that can be done and a lot more workup that I usually order, and more, an underlying cause that we can actually identify and treat and get people feeling better. Because if you're just given a diagnosis of IBS, whether or not that's constipation, loose stools, or a mix of the two, you're kind of usually sent on your way to kind of treat symptomatically for the rest of your life, and not a lot of guidance is given. So what I like to do with my patients is we continue to investigate further to determine the root cause. And today I'm going to talk about kind of the most common things I think about and the most common conditions that I test for, functional tests that I like to do to try to figure out what else might be going on. And these things are all things that I see every week, pretty much every day in my practice, and things that we can treat and that I treat successfully and get people to feel better. And I will say, the conventional workup that most people come in with is very, very important. Like, if someone comes in and they haven't had any workup done, I'm making sure to do, all the general things. We're doing a CBC, we're checking for metabolic panel, we're checking thyroid, anything in the blood work that makes sense. I'll also do a candida, checking candida in the blood work, screening for celiac, screening for food allergies, H. pylori. Sometimes we'll order imaging, so if we need to check gallbladder, liver, here we'll do an ultrasound. Sometimes we'll order endoscopy, colonoscopy. We'll do stool tests for blood, calprotectin, white blood cells, open parasites. I'm making sure that we do all these, all this is very important as well. I'm not saying I skip over that stuff and go straight to these other tests, unless it makes sense to start with these tests, right? So it's all important. This is kind of just assuming someone's had all of this workup done and they've kind of left with symptoms and not really sure what direction to go in. This is where, these are the tests that I start with the most. I'm going to start off by talking about the most common condition that I believe is an underlying cause of IBS. I learned this in school in my advanced GI classes, and I find this in practice as well, and that is SIBO. SIBO, which stands for small intestine bacterial overgrowth. It's SIBO. And what that is basically an overgrowth of your normal gut flora. There's certain bacteria and pathogens that tend to overgrow and cause the issues, and we diagnose those based on the type of gas they produce. So you'll know that we have a normal gut flora. We want bacteria in our gut, but we want that majority in our large intestine. That's where we want the beneficial bacteria. And what happens with SIBO is that, for various different reasons, there's certain, risk factors and contributing factors that increase your risk of SIBO or the likelihood of SIBO, which I can talk about in another video. But we get a slowing down of gut motility, sometimes dysbiosis, and that bacteria that's in the large intestine can get backed up and overgrow in the small intestine, which the small intestine is lined with all these villi, and that's where we want to absorb all of our nutrients in our food. Don't really want a lot of bacteria or other pathogens in there that are going to pretty much eat our food, ferment our food, and produce gases. So with SIBO, these bacteria and archaea overgrow in the small intestine, and they ferment our food and create gases, which cause bloating and constipation and acid reflux and gas pain and loose stool, all the symptoms pretty much under the sun. And we can test for it. So this is tested for with a breath test. You want to make sure you do a lactulose breath test, no other substrates. I do see, every once in a while I'll get some patients in who their gastroenterologist tested them for SIBO, or they refer to me to test them for SIBO, and I test this all the time. It's an at-home breath test, and we reduce the number of pathogens, focus on motility, support, and then repopulating with good bacteria, and get a lot of people feeling a whole lot better. So that's kind of number one. And then piggybacking off of that, not SIBO, but a very similar condition that I often see going hand in hand with SIBO, which is intestinal fungal overgrowth. So another very similar condition. We get, instead of bacterial overgrowth in the small intestine or large intestine, we can get it fungal overgrowth. So often I'll see candida, but there's other types of fungus and yeast that we can find too. So candida is a really big common one. Also, like rudatirola is another one, and just sometimes unidentified yeast species that we'll find. Similar pathophysiology is just fungus overgrowing in your gut, or yeast rather than bacteria, and kind of treating the same way, except we're using antifungals instead. This is a little bit harder to test for. The testing is really imperfect. I'll often run Candida Immune Complex Lab through Quest, which tells us about potential Candida overgrowth in the gut. Sometimes Candida antibodies can be helpful, but not always. And then stool testing for yeast, also kind of hit or miss. It's, just because it's not there doesn't mean that problem's not going on. Just because yeast is there doesn't mean it is. Just because there's normally yeast in your gut. But again, like with SIBO, it's okay to have it there in your gut, but when it starts to overgrow in too large of amounts, and that's when it can start causing symptoms, similar with SIBO. So I would say those are kind of the top two things that we think about. Another kind of realm of conditions that I also see kind of mimicking SIBO is histamine disorders. So like histamine intolerance, mast cell activation syndrome, or systemic mastocytosis. And usually with this, with like a mast cell or histamine issue, I'll often see like skin symptoms as well, so like hives or urticaria, allergy type symptoms, headaches. Usually with these, as far as digestive symptoms go, I'm seeing more like nausea, more like pain, more of a loose stool type picture. That tells me a little bit more about histamine disorders, so that is tested for in the blood work. So you would test like a histamine and tryptase level in the blood work. So that's another pretty rare, but something to think about as well that doesn't always get tested for. So histamine is one piece. Next, usually, I'll start with testing for SIBO and the fungal overgrowth. And then one of my favorite tests that I like to do as a next step, or even right away if it makes sense for somebody, is a comprehensive stool analysis. So I feel like in my practice I give out these kits like candy. I wish everybody could do a comprehensive stool analysis, like no matter what condition you have. I think it is so beneficial for just anybody's health. Because your gut is so important. Like, my belief is that the gut is kind of the core of everything. Like, if somebody comes in for whatever it is, not even necessarily digestive concerns, and they have GI symptoms, I go straight to the gut, because I find it really hard to heal the rest of the body if you have something going on in your gut. I think that's why I love GI and skin paired together, because with all my skin patients, with all my derm patients, usually like the biggest place I start is treating the gut. So what a comprehensive stool analysis is, and my favorite test is the Genova GI-FX. I've also used the GI map by Diagnostic Solutions. That's another really good one. I've kind of leaned towards the Genova one for a couple of reasons, but either of those are really good options. What I like about these tests is that they kind of tell you everything you could possibly want to know about your gut. So it's going through all your beneficial bacteria, the different levels. So sometimes I'll see you have like generally just low beneficial bacteria or really high levels. And then certain bacteria, if they're high on there, can indicate even a couple types of SIBO, so it can be helpful for that. Like if I'm suspicious of SIBO, plus I think something else is going on, overgrowing, whether it be a different bacteria or parasite or whatever it is, low pancreatic elastase or something like that, I'll just start with the GI effects, and you know, rather than doing the SIBO test, and just kind of assume SIBO is present, and we can get some ideas of that on the commensal bacteria page. Then it goes through how well you're digesting your macronutrients, so like fecal fat, fecal protein. It goes through markers of pancreas and gallbladder function, various different inflammatory markers. It even screens for calprotectin, which would screen for inflammatory bowel disease. It goes through markers of metabolites of bacteria in your gut, so like short-chain fatty acids and beta-glucuronidase. Then it goes through pretty much every pathogen you could ever want to test for, so bacteria, parasites, yeast, and you can add on different tests like H. pylori, you can test for viruses, you can test zonulin, which checks for leaky gut, so just everything you could want to know. And I'll usually do that as a next step, but sometimes I've been doing it more kind of right off the bat just because I find it so helpful. It checks for so many more species of pathogens than just a general test that you could run through like LabCorp or Quest, so that's why I really like it. It's a pricey test, but it is billed to insurance, which is very hit or miss, but I do find that it is worth it and so helpful. Why I like the Genova test the best is that if they find any pathogens in your stool test, so like any bacterial pathogens, they do a culture and sensitivity and tell you which antibiotics and herbs as well. They do this for herbs as well, which is so cool. And they tell you what is going to be best to treat that specific pathogen that was found in the stool for that patient. So very cool. So those are the most common things I do, you know, screening for SIBO and fungal overgrowth, and then doing the stool test. Sometimes food sensitivities are controversial. I don't always start with food sensitivities. A lot of my colleagues do. I usually wait to do food sensitivities till like way later on once I'd rather do like a stool test or SIBO test first to like clear any infections or like correct any malabsorption or dysbiosis that's going on. Like I'd rather start there, because what I find, like if I've learned, like if we do food sensitivities, which is checking for IgG or IgA antibodies, it's different than allergies, so there's a distinction there. A lot of times if you have an infection going on or your gut's just inflamed, I'll see these tests like just light up, like being sensitive to many more foods than you normally would. I think just because there's generalized inflammation and leaky gut going on, like your immune system's just a little bit more overactive, so it's gonna be more reactive to more things. So I'll usually wait. I'd rather like clear the infection, like focus on gut healing, gut health, and then as a like later down the road, sometimes we'll do food sensitivities. Yeah, that's kind of those are the things that are coming to my mind. I might be forgetting some things, but I think like this video, the couple tests that I mentioned is a really good place to start. Like I think you're gonna find a lot of success just starting with those things. The purpose of this video is just to kind of, you know, give hope, give some direction to you if you're struggling with symptoms, you're struggling with a diagnosis, that you feel like you want to have some more investigation, you know, like, you know, there's something going on. I'm here to tell you there is most certainly something else going on, and more workup is almost always indicated. So I want this to be a reason, you know, talk to your doctor about it, maybe seek out care from a functional medicine provider or a naturopathic doctor in your area. I hope you enjoyed this video. I hope you found it informative. This is just kind of, you know, my personal experience and what I see in practice. That's all I can really speak for. But yeah, I hope you enjoyed the video. Go ahead and give it a like if you enjoyed. Make sure to follow for similar content, and I will see you in my next video. Bye!